Hello, my name is Nicholas Rosas. This will be my personal narrative speech. Okay. For the first questions, tell me about yourself. I'm a 33-year-old um, full-time nursing student. I'm a LVN. I've been an LVN for almost 8 years now. For six of those 8 years, I was a hospice nurse. I'm still doing that currently. Um, I'm a father of three. I have a 6 month old, I have a 5 year old, and then my son is six. My partner, Janessa, who I've been with for over 10 years now. We're building our family together right now. I'm trying to finish school. My main goal is to complete the RN program. Um, what's motivating me to become an RN is my passion that I found for nursing. I used to be a warehouse worker for a long time. I didn't know what I wanted to be, what I wanted to do. Um, my girlfriend was a nurse when I met her. She encouraged me to try to be a CNA. I did that. I saw the LVNs, knew that they got paid better, so took advantage of that. Became an LVN. Just want to kind of continue to grow in my profession. The next step for me is obviously an RN. I'm not sure if anything's past that, perhaps BSN. Um, but the motivation is partly financial. I want to build a better fa future for my family, a better home for them, make sure that things work out best for them. Um, that is my main motivator. And challenges I see being an RN are I'm already a nurse, so I kind of have an idea of what those challenges might be. So, for instance, caring for families, difficult family members, difficult patients, aggressive patients, confused patients, following policies, hospital policies that kind of go against your instinct as a caring person. Um, Time management would be hard. It's always hard as a nurse to try to fit everything in with the level of care that you feel is appropriate. Um, One thing I will find challenging is if anything related with kids. Doesn't want to. I'm not looking to have a specialty with kids, pediatrics, but I know it would be hard. Say I were to work in an ER, you don't decide what age of the person who's having an emergency is. They just show up, so it could be a child, a baby. So that would be something that would be hard for me to overcome and kind of get past. Uh, how would someone describe me? They say I'm funny. I'm lighthearted, kind of not serious a lot of the time, but when things get serious, so do I. I know when to kick it into gear and when to uh, prioritize patient care and the seriousness of the situation. Levity's good, and I don't mind having lightheartedness, but as a nurse, there are times where you have to be serious and you have to kind of get down to the matter of the fact and say, this is what we have to do to get you better. This is how you heal. Um, and you can use different tools to get people to get to that goal because a lot of the problem is a nurse is trying to get the patient to see that you know a lot of their behaviors are causing their sickness, and having them identify that and change that is like one of the hardest parts of being a nurse. So I would say that's one of the skills that someone would describe I have is being able to kind of talk and relate to people on a personal level. um, I'm a good coworker. I'm relatable. I try to be someone you can rely on. I like to go by the mantra of, or not the mantra, but the saying of like, do unto others as you'd have others do unto you. So that's kind of what I live by. Um, what skills do I have that will bring me to the role as an RN? So, like I said, I've already been a nurse. I know there is a difference. That's when I'm learning the difference in terms of medication, IV medications, but a lot of the tools is kind of the experience I've gained out in the field as a hospice nurse, dealing with patients, interacting with other RNs, seeing what their duties are, their responsibilities, how they interact with families, how they treat other families. Those are all beneficial. I kind of have like an insider view, you could say, of how it works. So I won't be too foreign to the idea of being a nurse. It's just knowing and educating myself in the areas and specialties that I need to know. Um, I am bilingual. I speak Spanish and English. My Spanish isn't the best, but I do make it work. Um, I have managerial skills. I have managed a team of 14 people before, not in healthcare. but in a warehousing situation, I have overseen CNAs at a facility. So I do have an experience of being able to communicate needs, work with a team, dictate responsibilities, basically kind of evenly spread out the load and make sure that we accomplish our goals as a team. Um, and so, how could I explain empathy and what it means to be empathetic? So, to me, empathy is putting yourself in someone else's shoes and kind of giving them leeway for certain behaviors and certain actions because of that. So, if you have a patient who's in a lot of pain and you come in and you say, "Hi, how you doing? I'm Nick. I'm here to take care of you," and they just say, "Hey," don't focus on that. That's nothing personal. That's the pain. That's the job. Um, Being empathetic is understanding that person's probably hurting. How would you feel if someone came in happy and jovial while you're sitting in a bed in severe pain? You'd want them basically to be quiet and leave you alone. As a nurse, you have to kind of be over empathetic, not sympathetic, empathetic, so that you can understand and give leeway to the patient when they treat you a certain way, when they respond a certain way, when they're disrespectful. Because it will happen, it has happened, it'll happen your entire career. Knowing how to handle that, I think, is very important and very key. And one thing I will say, going back to being empathetic, is being empathetic to your the staff underneath you, LVNs and RN, CNAs. They are overworked, and a lot of their work is physical. It's a lot harder. So being able to empathize with that and say, okay, let me help you where I can, and have them in return help you where they can. Having a cohesive relationship, I think, is the most important part. Um, at the end, do you have any questions? I always try to end these things with questions about expectations. What do you expect from me? Um, where do you see us as in terms of our work relationship in 5 years? I like to ask that. I usually try to ask them policy questions too. Uh, what what are your benefits? What are the hours? What is your census? An important thing to ask any company you work for is census. That's the amount of patients they have on hand. That can help you determine whether or not you're going to be on for long or not. So the one question I ask is, where's your census? How many patients you have? Do you see yourself still being in business 10 to 20 years from now? Um, those are the things that I look for. You kind of want to turn the interview around and make the interview work for you. That's why I try to ask those questions. That was my personal narrative speech. Thank you.